Hi, I'm Dr. Gerald Spindell, welcoming you back to Ion Health. Today our guest is Dr. Edward Jacobs, a psychologist practicing in Londonderry for the past, was it 23 years?
Mm-hmm.
Yep. I'm still a little older than you, I can say 26 years. And we've been talking about the use of neurofeedback for the treatment of ADD, ADHD for children and adults. And I wanted to switch bases a little bit and talk a little bit about autism. Autism is getting a tremendous amount of press and TV coverage. A lot of movie stars and things like that have children who are autistic, athletes and things like that. So suddenly, I'm sure there's a disease that's been there a long time, but now suddenly we're hearing a lot about it.
Much more prevalent.
Much more prevalent. Tell us exactly what autism really is.
Well, autism is a spectrum disorder, meaning it exists on a continuum. Originally, autism was seen in the most, or identified in the most dramatic form. Kids who were nonverbal, kids who were banging their head repetitively,
right.
Kids who just couldn't make eye contact, couldn't tune in socially. A lot of these kids had to be institutionalized. What's been recognized in the past 10, 20 years or so is that there are a lot of kids who have characteristics of autism without the full spectrum. And the most defining characteristic of these children and adults is impaired social skills. These kids have a hard time reading social information, responding to social cues, putting it together to just understand and flexibly know what's going on. If you think about it, when we're in a social situation, we're processing thousands of bits of information every second. So we know intuitively, those of us who are not on the autism spectrum, are we boring this person? Are we irritating this person? Are we in this person's personal space? Is this person enjoying the interaction? And plus, we have the whole history with the person. This is a person I've had friendly interactions with before. Is this a person who's been mean to me? You know, if you're on the playground. We put together the words and the music, so to speak, the affect over the emotional connection, the verbal interaction, everything we know in every split second. And our right hemisphere mostly processes that and then integrates it with the left hemisphere to integrate a response. In every split second, we're adjusting ourselves. It's like a dance we do when we're interacting with somebody. With autism spectrum disorders, that ability to intuitively process that information, respond quickly, integrate it, is impaired, it's damaged. A lot of these kids are very bright, a lot of these kids can be very successful, but the older they get in school, the harder time they have making friends, interacting smoothly. Sometimes they're like automatons. They practice interactions, but it seems stiff, it doesn't seem natural, it doesn't seem relaxed. A lot of these kids develop very focused, fixed interests in kind of odd things. Sometimes they'll develop interests in like the Civil War or swords or electrical power lines, or they'll have this incredible memory for these obscure bits of information that they will want to share with everybody, and kids just aren't interested in some of the things they're interested in, but they don't get it that they have to talk about other things. So as these kids get older, often they're not invited to birthday parties. They don't have kids over. They don't have play dates. They get teased. They get bullied. It's really heartbreaking. Mm-hmm. A lot of these kids are the sweetest kids you'll ever want to meet.
Sure. This is where the perception comes that they're the geniuses for certain things, but because they're extremely interested in, say, music or something like that, or art, and they develop those skills because they're so interested in it. Is that where that comes from, that whole concept of that?
Yeah, they have a laser-like focus on one thing or two things. And a lot of these kids are misdiagnosed with ADHD early on because the social interaction piece is not so evident when you're 3, 4, 5 years old. When you start getting older, it becomes more important. So a lot of these kids who are diagnosed with ADHD get diagnosed with Asperger's or autism spectrum disorders later on. And what we're finding, in the past 5 years, there's been some good research with neurofeedback with autism spectrum disorders. And what the research has found is that in a lot of these individuals, different parts of the brain are not communicating cleanly, clearly, consistently. And often parts of the frontal lobe are hyperconnected, where they're overly in sync with each other. And when you look at a lot of these kids, they tend to be very rigid and very inflexible. They do the same thing over and over, the same response, the same questions, the same behaviors. And meanwhile, the back of the brain, that perceives sensory information, that perceives incoming stimulation, is not connecting smoothly, is not firing in sync with the front of the brain. So the back of the brain tells us what's going on in the world. That information gets ferried to the front of the brain. The front of the brain decides, what do we do about it? How do we act on it? So you can see if the back of the brain that's perceiving the social world is not firing synchronously or in sync with the front of the brain, you're not going to be able to smoothly respond the way you need to be in social situations. So there's been protocols that have been developed based on what's been found by quantitative EEGs to treat autism spectrum disorders with neurofeedback. Now, there's no cure for this. I don't want to pretend that we can cure it, but I have seen the symptoms be ameliorated. I've seen some kids develop less anxiety. They're not so overly stimulated, overly activated when they're in a social situation or they're in a busy, loud noises, birthday parties, gymnasiums. They become more flexible. They become emotionally more reactive, more mature, develop better social skills. And a lot of kids, it's slow going. Some kids I've seen very quick improvement. It's really been remarkable to see.
How young can you start these kids?
I've seen kids as young as 4. I know other clinicians who have seen kids 3 and 2 years old, but I think it's the rare 2 and 3-year-old that can really sit there and maintain focus and play that game and understand what's going on. But I've seen kids as young as 4. I may have seen 1 or 2 kids as young as 3.5. Can
you tailor the game to something they're interested in? And so if the child is interested in trains or something like that, or something, a particular toy, can you tailor the feedback to a particular toy, or you really can't? You don't have that.
There's a variety of games. The newer systems coming out enable you to play DVDs. And so if you have a DVD-enabled system, the child can bring in a DVD and put in the DVD, and the DVD then will start and stop depending on the brainwave activity. The reward is the DVD continuing.
I see.
And when the brainwave activity is out of the pattern, the screen will get grayed out, or the action will slow down.
That's fascinating.
Yeah.
That must be very effective for kids' videos and things like that.
Yeah. Yep.
That's fantastic. That's fantastic. How is the acceptance of this neurofeedback in mainstream medicine, pediatrics primarily, I would imagine, for kids with both ADHD and autism?
Well, it's mixed. I've been in this community for a long time, so people know me, and I think people tend to trust me. So I've worked with a number of physicians whom I've told I'm doing this, and they will refer people to me, or they will trust my judgment. People who don't know me and haven't heard about neurofeedback, it generally is not very accepted. You know, I find that people don't really accept what they don't know. We're all trained in our little, niches. There's legitimately, there needs to be a lot more research. There isn't a ton of research. The research is slowly coming out. The research has been good. But a lot of physicians aren't aware of the research, and they'll just dismiss it out of hand. And if it's somebody I know, I might call that person and say, have you looked at the research? I understand that the research is incomplete, but the research is promising. It is very positive. So don't dismiss it if you're not aware of the research. If you're aware of the research, you want to discuss it, we can do that. So the medical community is mixed, but I think it's this kind of thing that if people have experience with it, they've seen patients who have benefited from it, they become more accepting of it.
Are you ever able to decrease a patient's dependency on medication, say for either ADHD or autism, with neurofeedback?
Yep, I'm thinking of 2 adolescents I saw. One had ADHD and depression. The other had ADHD, learning disabilities, and some autism spectrum characteristics. One had been on medication for 6 years, had been on 2 medications. The other had been on medication for 8 years. He was about, for 8 years, yeah. Both of them were completely medication-free at the end of neurofeedback training, at the end of 20 to 40 neurofeedback sessions, seeing them twice a week.
Wow.
Now, I can't guarantee that result for everybody. Sure. I can't guarantee results for anybody. But I've seen kids get completely off medication. I've seen other people decrease medication. I've seen people decrease their antidepressants, stimulant medication. In fact, with people on stimulant medication, if a person comes to me and they're already on medication and I train them, I will always call the physician who's prescribing the medication, and I'll introduce myself. I'll say, I don't know if you know much about neurofeedback training, but this is what I'm doing. And because we're training the brain to do what the medication is helping the brain doing, we may see signs of being over-medicated. If I see those signs, I want to be able to contact you and let you know that, and then you can make a decision about whether you want to, change the dosage. But I'll always respect the physician's prerogative
Sure.
And knowledge about medication. But my belief is I want to communicate.